Welcome back. You're still watching the Daily Debate, and I am honored to be having with me over the program for tonight Dr. Saied Abdel Hadi, the current president of Horus University and the former dean of the Faculty of Medicine at Mansoura University. Thank you very much for being with us tonight on the Daily Debate.
Thank you for having me.
Anytime. Of course, firstly, Dr. Saied, I would like to be assessing the presidential initiatives over the past decade in terms of having more development, more progress in the field of the health in general and the health insurance in specific.
Okay, that has been a very successful decade for the health in general since the president took office, and I would refer shortly to 100 million health,
yes,
which managed to eradicate hepatitis C. That was followed by another very successful initiative to cut short the waiting list for major surgery, which was another problem facing many teaching hospitals. And then came the mega project of the comprehensive national insurance, which is phase 1 is completed and now moving to phase 2. So we started with 4 government rates, now to move into another 5. And hopefully by the 2030, the whole country would be involved in this mega project.
On the other hand, how do you think this improvement in the field of healthcare has affected the citizens, the feeling of the citizens over the past decade for this field?
Indeed, health in general means complete physical, mental and social well-being, and not merely the absence of disease or infirmity. And applying this to the community, we need to look for cure of disease, in addition to prevention of disease, making life better or a better quality of life, maintaining the social integrity and maintaining the mental health. And this will come through different facets or different aspects of life. There would be economic development, so rich people live longer and live a better quality of life. There would be social solidarity, so people will come together, the rich help the poor. There will be the Decent Life project, which is another very good project taking place in the rural areas, which has been unfortunate for decades. So things, again, there is economic development, nobody can doubt that. There is improvement of indices of health all over the country. The best measurement is the quality of life as well as the longevity at the time of birth, or life expectancy has increased progressively. When I was a medical student, the median survival for women was 54 and for men was 52. Now it increased 20 years, so it's now 74 and 72. So other indices, the emergency service has improved significantly. Now any phone call to the ambulance or an accident or a fire, things are moving. So in general, health is an outcome and an indication of the whole health of the community. In particular, I don't mean health here referring to the disease and illness, but the sound life, the manner people live, the quality of life, and that's very important.
Yes, regarding the presidential initiatives, of course they have a lot of achievements, but they had targets at the beginning of the presidential initiatives. How far do you think those targets were achieved and were successfully completed?
Yeah. If we take the initiative to eradicate hepatitis C, it was 100% successful.
Yes.
To cut short the waiting lists is still progressive, because all the time you cut short the waiting, but another waiting coming on, so it is again successful, looking at the number of major surgeries that exceeded millions of operations now. Number 3, the comprehensive health initiative that's staged. Phase 1 is completed, we're moving to phase 2 at a estimated speed, so hopefully we can catch up in the next 6 years and complete the other of the rest of the country. So things are fairly good. I mean, also there are initiatives for the newborn, initiatives for the chronic illnesses, initiatives. You can forget as well the corona pandemic, which was managed Egyptially by a successful way by all indices.
Yes.
So things are getting better for health. But the way is, the more you get better in health, the more people expectation and the more you need to invest more. So it's a visual circle all the time you catch up, you will see something is coming in on you, you need to catch up and so on. So this is the nature of things in health in particular.
Yes, you mentioned the comprehensive health insurance system or the universal health insurance system that was implemented here in Egypt in several governorates as a phase one. And you mentioned, Doctor, that phase one was completed and completed successfully as well. So how would you assess the first phase of the comprehensive health insurance system? In how many governorates it has worked, how many citizens it has benefited or served, and for the future, for the upcoming governorates, how many governorates are we aiming for the next phase?
Very good. We started with 4, Port Said, and then Ismailia, Luxor, and Northern Sinai. And you will see the canal governorates, 2, 1 in Upper Egypt and 1 in Sinai.
Yes.
As we take the figures, about 91% of the population in these 4 governorates have been served by the comprehensive national insurance system, which is very good, above 90%. I would say things are slow at the beginning because people need to get confident in the system and it works. Also, we learn from our experience as we go. So if we took 3-4 years in phase 1, we could do phase 2 in another 2 years, we could do phase 3 and last in another shorter time. So it is a cumulative experience, I would say. So 91% takeover is very good. We hope that people will get more confident because the rationale of the national or comprehensive national insurance is all members of the family are managed by the healthcare system. Everybody should be registered with the GP and then a referral system from primary to secondary and then to tertiary level. Sometimes as Egyptians we think that it is better to go to a well-known physician in a well-known center to treat minor disease. This is not the rationale of the national insurance. But the way we will get confidence in the system will get mature, it will take time, needs money, but things are moving in the right direction.
In terms of efficiency and quality, of course, you've mentioned, Doctor, that we are serving about 4 governorates with millions of people living throughout those 4 governorates. But how do you assess the efficiency and the quality of services that were provided to the citizens along phase 1 of the comprehensive health insurance system?
Efficiency improves with time, and that's the nature of things in health. You won't expect things to be 100% efficient. There is nothing like that in real life. But things are getting better. There is efficiency and cost effectiveness as well, and these have to go both hand in hand. So you can deliver the service, but at a reasonable cost and within a reasonable time. That's what's called difference between efficiency and cost effectiveness. And I think the indices has been successful, especially in Port Said. I work in Dumyat, very close to Port Said. I hear reports Ismailia is very successful. Again, we all know the differences made in Luxor and also in South Sinai. So things are improving in the right direction. But I would say that any objective assessment of things will need that. In health, you will need time. I would say the experience of the best national insurance system in the UK started in 1947. And it took around 50 years to be mature because you will need stratification of the service, building of primary insurance service. And now we are in need again of the digitalization and getting everything digitalized and called Maikana, or getting the computerization of kind of things. So a lot of things coming together in addition to allocating the staff, training of the staff, getting help from the community and acceptability within. So there are a lot of social, economic and technical and medical aspects intervening together in this mega project, and all have to come together. It is an integrated work, and also the private sector intermingled with the with the Ministries of Health and Ministry of Higher Education and with the ambulance service. All these have to come together in a orchestrated, well-planned system.
Yes, Doctor, of course, we have seen over the past decade under the tenure of President Abdel al-Sisi improvement in the infrastructure in general. But to be specific, how would you assess the improvement in the infrastructure that is helping to be having better services for the healthcare, for the comprehensive health care insurance system, and of course for the health sector in general?
Very good. Definitely the infrastructure has witnessed evolution, you know. especially the roads and road safety. And this, by the way, is a part of the success of the healthcare system. Because if you have an accident on the road, and the road is plugged or two traffic jams, people are injured, won't go to the facility on time.
Yes.
So every investment in just one aspect will make better life for people and will make health is much better. Coming to your question, I think it has been moving a bit slower, but as expected. I say we don't expect things to move very quickly from black to white nowadays.
Yes.
You have to run through all the spectrum things. But an overall objective estimation, we have seen hospitals built everywhere. Even I came from Mansour, I have seen many well-established and well-furnished health facilities. Taking into consideration there is a financial crisis all over the world, and it also coupled with increased expenses. So you always move within an environment of complexity. It's not one side, you can do this and can do that, but things are interacting together. But overall, in an objective estimation, it is moving in the right direction. We are witnessing real improvement, and we are hoping for more, because again, health service needs more money, and these should be allocated. And with time, I think now the main focus of the government is in health and education. Yeah.
Yes, you've mentioned, Doctor, that we need more money, we will be spending more money, and the upcoming report will be specifically focusing on that. But before going to it, I would like to ask about the staff. You've mentioned that the staff, they need training, they need to be understanding the new infrastructure, to be understanding the services that are being given to the citizens, to the patients. On the other hand, President Abdel al-Sisi touched upon a very important topic, that a lot of workers, a lot of doctors are focusing and developing their skills to be going outside of Egypt, to be living outside of Egypt, to be working outside of Egypt, more specifically the United Kingdom, for example. So do you think that this would be solving this issue, that if we have better infrastructure, better hospitals, better systems, this could be more attractive for the doctors, for the people working in the health insurance system or the health sector in general, to be staying in Egypt and providing those services to the Egyptians?
I can add more, but taking into consideration we have around 300,000 Egyptian doctors registered within our syndicate. Only a third of these are working in Egypt, 100,000 for the Ministry of Health. To attract the majority of those to come back or to be involved, or simply to keep those who are graduated, we graduate around 15,000 Egyptian doctors each year, but we cannot retain them because all of the causes that you have mentioned before, because of working environment, because of safety of the hospital, and because of payment. So an important part is for the young physicians to get the income that makes them have decent life, and to get training to become good doctors. If we just improve these two factors, paying them good, getting them well trained, doctor will be retained, and this health service will get benefit from them. Definitely.
Yes, and one of them is paying, which is focusing on spending and money. We will be having more details regarding such an important topic in the upcoming report, as Egypt is increasing the spending on healthcare for the upcoming fiscal year. We'll be having more details in the upcoming report regarding such an important topic and such an important decision by the Egyptian government, so stay tuned.
Ministry of Planning and Economic Development examined the objectives of the plan for the current fiscal year 2023-2024 in the field of health services. Minister of Planning and Economic Development, Dr. Saied, emphasized that improving the health level of citizens is a proper human right in line with the main principles of the National Human Rights Strategy, which crystallize around human right to obtain a high-quality health care. At the top of these constitutional rights is the allocation of funds necessary to ensure comprehensive health care for citizens, channeling at least 3% of the gross domestic product to improve health services. Improving the health of citizens within the framework of justice and equality is also a key objective of the Sustainable Development Strategy Egypt's Vision 2030, and is particularly represented in the third objective of good health and well-being. Al-Saied added that the provision of comprehensive health care is one of the main components of building the Egyptian nation because it ensures comprehensive health care for all citizens and offers a radical solution to development gaps, ensuring the improvement of people's living standards. The 2024-2023 plan aims to allocate an estimated total investment of 75 billion Egyptian pounds in health services, which is 4.6% of the total investment in the plan for the same year, to implement many development initiatives and projects in the development of health services. The report stated that the projects of the Health Investment Plan in 2023-2024 include the development and improvement of existing hospitals and 29 infirmaries, 49 hospitals, and the commissioning of 55 hospitals in the plan year. Of these, 46,000 are affiliated with the Health Board and 9 are university hospitals. The plan is also to develop and equip medical centers and units, the development of an ambulance building, the delivery of unified national emergency and security network units, and the completion of strategic projects, the most important of which are Medical City Nasser Institute. The report highlighted the achievements of the health sector in the last financial year, which are the increase in self-supply of medicines to 93% and the opening and development of 9 physiotherapy departments in 6 city centers and hospitals during the first quarter from 2023 as part of the plan for the provision of physiotherapy services in all the provinces of the Republic. This also includes the launch of an initiative to support services of primary healthcare departments and centers to provide integrated health services in villages. The Egyptian government also plans to launch the Your Health is Your Wealth initiative for the early detection of prostate tumors and the Go One Step Ahead initiative for the early detection of cervical tumors, providing more than 13,000 services. The Medical Tourism Agency project We Take Care of You in Egypt was also launched to attract foreign arrivals to the agency's hospitals for treatment.
Welcome back. You're still watching the Daily Debate, and I am honored to be having with me over the program for tonight Dr. Saied Abdel, the former Dean of the Faculty of Medicine at Mansoura University and the President of Horus University. Thank you very much for being with us tonight on the Daily Debate. Doctor, you said that we have better infrastructure and we have better training for the workers at the health insurance system or the health sector in general. But on the other hand, do you think that the people or the citizens or the patients, they have the patience to be having better services for the future? Because you mentioned for the United Kingdom in specific, they had to be patient for at least 50 years to be reaping the fruits of their efforts in 1947.
Absolutely, and this is true especially in the health sector. Things won't change overnight.
Yes.
Because of the complexity of things, you will need the staff at one side, the training, the infrastructure, the money, and the environment as well, the security in the hospital, and the feedback and reflection from the community. So the last portion is the most significant, because if you do all things and people are not satisfied, then you haven't achieved a lot. But in Egypt right now, I think everything is moving together. It's not only in the infrastructure sector, but in the health sector, also in the decent life and also in the initiatives. So, as mentioned in the report, there are many very successful initiatives for the early cancer detection, and that again, as people move from curative to prophylactic, then you mean there is development in the community. I mean, health started by looking after the ill patient. Now, health has moved to preventing the development of the diseases, and Egypt is moving in the same direction. So now I have initiative to cut short waiting lists, as we said, and we have initiative for early cancer detection, for anemias, for dwarfism, for hearing loss, for vaccination and immunization. So I would say in health, prevention is more successful than cure, because in cure you just remove the disease that is already happened. More successfully is to prevent it happening through the whole things coming together. But people feeling regarding improvement takes longer than expected. We don't expect in one phase or in one governorate or a successful or a less successful experience, some here and some there. You will never get in health 100% success, simply because there are laws. We deal in human lives and there are human laws. People will die at the end, whatever you do, yes, because of the complexity of the disease. And anyone who lost a member, a loving member of his family, wouldn't be happy. But the whole impression of the people is it is a move in the right direction. There is a lot of effort done. There is a lot of money spent and a lot of more money to be spent. And things are moving in the right direction. And although it's as nature of things, it's taking time, but that's the only way you can do it. You cannot move, you cannot get a very trained physician in less than 10 years. You cannot get a very efficient healthcare system in less than 50 years. These are the experiences in the world, but we are working on it. And it will take time, will take effort, but we have to do it.
Yes, so we as citizens, we have to be patient with the healthcare sector in general, with the health sector in Egypt, with the comprehensive health insurance system in the country, to be specific. But you mentioned a very important topic, a very important presidential initiative that we have seen over the past decade as well, which is the Decent Life Initiative. Of course, there is a medical sector, a medical field for the Decent Life Initiative, because we have seen a lot of construction, a lot of establishments, a lot of roads, bridges, technology, internet going to villages as well. But for the healthcare, for the hospitals, for this field in specific, how do you see the importance of the Decent Life Initiative for thousands of villages, for millions of people?
That's very important, because 6% of Egyptians are living in the rural areas.
Yes.
And this has been poor to some extent, or inefficient, insufficient for many decades. Now, this is the first time in history, in modern history I mean, that the villages will get decent roads, water, sanitary water, waste disposal, sewage disposal. All these kind of things are better indicators for health, because as I said before, health is complete physical, mental and social well-being. Even if you improve the financial status of people, they will get more healthy. If you improve water supply and waste disposal, they will get more healthy, because these are the causes of the disease.
Yes.
Even if you give the people the impression that they are safe and secure and the government is looking after them, they will get more stable and more mental health. So communities are very ill in times of war and famines and strikes and all this kind of thing, but people live longer and live better when they are stable. So stable country, looking at the less privileged people in the rural areas, makes the whole community more stable and brings together the whole aspects of the community.
Yes, Doctor, ever since President Abdel al-Sisi took the presidency of Egypt for the first time about a decade ago, there was always a focus on having contributions by the private sector in every field of the society. There will be cooperation, coordination at least, between the government and the private sector, to say the least. But in the health sector, how do you see the importance of the involvement of the private sector and the role of it in terms of investing in the healthcare system and in the health sector in general, and of course for the comprehensive health insurance system for the future?
Thank you for asking a very intelligent question.
Anytime.
And the fact right now is over 6% of health service is provided in the private sector. Now the government is planning to get the private sector more involved, because number one, it's getting very costly for the government to carry on. Number two, the health sector, the private health sector, is more clever in providing the service at a short and less bureaucratic way. So you can go to the private sector, you need surgery done tomorrow, you can get it done tomorrow. But in the public sector, because of the waiting list, because of the numbers of people turning on, you can do that. Another thing is the private sector can provide the things that are not suitable or not available in the public sector. And that is the nature of things. Because even in the best insurance system, we still need the private sector, because people won't wait. For example, in the UK, I used to deal with cancer patients. We used to say the waiting time for us is 8 weeks. People will say, no, I have money. I don't need to wait 8 weeks to go. He goes to a private sector and he gets it next morning. You will find this everywhere. So the private sector can also bring more technologies. They can import foreign physicians' expertise. They can have the up-to-date equipments and the instruments and all this kind of thing. So definitely the integration between both. And this is what's happening in the comprehensive healthcare system, because yes, there will be a contract with the private sector. The hospital that get the quality assurance, they will be involved within. So definitely you can move without the private sector everywhere. Even in education, there are people who need that. In health in particular. So definitely the cooperation, integration between all facets of the community, in particular the private sector, is very successful.
Yes, Dr. Saied Abdel, the president of Horace University and the former dean of the Faculty of Medicine at Mansoura University. Thank you very much for being with us tonight on the Daily Debate.
Pleasure, and I would be happy to see you every time.
Anytime, the pleasure is all mine. And this brings us to the end of the Daily Debate for tonight, but I will be leaving you, however, with a report about the latest presidential activities of His Excellency President Abdel Fattah al-Sisi over the past week in the upcoming report. Stay tuned. Thank you for watching, and goodbye.
President Abdel Fattah al-Sisi held a meeting to follow up on providing many projects in Lower and Upper Egypt with the necessary needs of facilities and services, especially in the electricity, water and irrigation sectors. President Abdel Fattah al-Sisi received Dr. Bashir al-Khassawan, Prime Minister and Minister of Defense of the Hashemite Kingdom of Jordan, in the presence of the Prime Minister, Dr. Mustafa Madbouli. President Abdel Fattah al-Sisi received a phone call from the Secretary General of the United Nations, Antonio Guterres. The call included a review of developments in the situation in the Gaza Strip, including the intensified Egyptian efforts to reach a ceasefire and a truce agreement. President Abdel Fattah al-Sisi received Sultan Mufaddal Saifuddin, Sultan of the Bohra community in India, in the presence of Major General Abbas Kamel, Head of the General Intelligence, and Mr. Mufaddal Mohammadi, Sultan's representative in Cairo.